Hi, I'm Steve Adubato. Welcome to another compelling, important program looking at the issues that matter most in our lives. And we kick off with our good friend, Joe Roth, President and CEO of the New Jersey Sharing Network. Joe, good to see you, buddy.
Good to see you too, Steve.
Yeah, we've been partners and collaborating with the Sharing Network for years, creating greater public awareness, if you will, around organ and tissue donation. Joe, do this for us. As we tape on May 20th, be seen a little bit after. First thing, is it a piece of legislation or is it law called the Kidney Transplant Patients Act Immuno Bill? Where is it right now?
It's actually been signed into law.
What is it and why does it matter so much?
Well, this is something that's been near and dear to my heart for the past 20 years. Medicare, in its infinite wisdom, allowed kidney transplants to be paid for by Medicare under the end-stage renal disease program. But however, they only limited coverage of immunosuppressive drugs to 3 years after the transplant. Then the patient would have to find another means to get the medication. So in about 20 years ago, our state senator, Bob Torricelli, introduced legislation to expand the coverage open-endedly for all recipients, but especially kidney recipients. It's a travesty to have that happen when you consider people wait many, many years to get a kidney, and they need those drugs to retain that kidney. And if they lose coverage and they can't find it, they may lose that kidney and then have to go back on the waiting list and possibly die waiting. So this is a great, great policy change for kidney recipients.
So let's put up the website for the Sharing Network so people can find out more. Will there be information on the website, Joe, about this Immuno Bill and what it means?
Yes.
And also on that website, you also see information about the transplant games coming up, which will be on July 16th, 17th, and 18th. Our team will be there shooting footage. Put the transplant games in focus because they will be a big deal and it's a national event. Talk about it.
Well, you know, last year it was supposed to be held in 2020, around the same dates. But COVID got in the way and it had to be postponed. This year, it's going to be a totally virtual event with people at the headquarters of American Dream. So this is an opportunity for recipients and donor families and people waiting to show what their lives are like, how transplant changed their lives and made them productive again, how they can engage in sports activities. And it's a very important way to promote organ donation and transplantation around the country.
So, Joe, in person or remote?
Most of the games will be remote. People will be allowed to participate in different events remotely and then send their scores in and get medals for that.
Tell everyone why that's such a big deal, because we've been collaborating for a long time about public awareness around organ and tissue donation. By the way, just if you want to understand the context of how serious the problem is, in New Jersey, just New Jersey, not even nationally, the waiting list for kidney transplants, approximately 5 to 7 years. How many people overall waiting for an organ? Just in New Jersey and then nationally, Joe?
Well, in New Jersey, there's over 4,000 patients total. About 3,000 of them are waiting for a kidney. And nationally, it's about 110,000 people waiting in total and about 90,000 people waiting for a kidney. And as you said, in New Jersey, you could be waiting for 5 to 7 years. In New York City, you could be waiting for 8 to 10 years. So it's important that more people donate and these people get organs that will save their lives. Signing up to be an organ donor through the Motor Vehicle Commission or through the Donate Life America registry, which is the other option, lets people know what your wishes are. Many people, families, when they come to the hospital and their loved one's in a crisis and may be eligible to become a donor, are not sure what their loved one's wishes were. So we've always told everybody, even if you're afraid to sign up for some superstitious reason or something, let your wishes be known to your family. A lot of people want to be donors and just forget to sign up or so forth. So it's important that your wishes be known, and that's why signing the registry makes it helpful for us, because that's a consent registry, and it makes it a lot easier on the families who are going through grief at the death of their loved one, knowing that their loved one made this decision.
So it's at the time we have, Joe, let me ask you this. We're taping again on late May 2021. If you were to assess the larger long-term impact of COVID on the organ transplant, not only process, but community, organ donation, organ transplant community, what would you say?
Well, initially we had no clue, obviously. And so last March, we thought the worst was going to happen and the whole year was going to be destroyed because of the lockdown for COVID. And April and May were slow years for us. So what happened was June, when the health centers started opening up, medical centers started opening up, our activity level actually increased, and we actually set an all-time record in New Jersey. And across the United States now, organ and tissue donation has bounced back and is poised for another record-breaking year, more lives saved than ever. We expect to do the same here in New Jersey. We are looking towards breaking the 250 donor mark for the first time.
Joe, so real quick, the demand has never been greater, but the response and the public response, to be redundant, has been more positive, even in these difficult times, to the need to say, yeah, I want to give, as your organization calls it, the gift of life.
Right. That's correct. We're really just grateful to the donors and the families who have responded with positive responses when their loved one has become eligible for donation. And it does save lives, and we are seeing that in the activity that we do.
Yeah, it's great stuff. So listen, Joe, thank you. We look forward to being at the Transplant Games, July 16th, 17th, and 18th. We will be there with our team and shooting not remotely, but out on the road. Thank you, Joe. All the best.
Thanks, Steve. Appreciate it.
I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Delta Dental of New Jersey, Hackensack Meridian Health, Investors Bank, Summit Health, NJM Insurance Group, the New Jersey Economic Development Authority, ADP, the Fidelco Group, and by Seton Hall University. Promotional support provided by ROINJ. And by NorthJersey.com and Local IQ, part of the USA Today network.
Many of New Jersey's children have been affected by COVID-19, but now that there's a safe and effective vaccine available for children ages 12 and older, you can help make COVID-19 history by getting yourself and your child vaccinated. Let's end this pandemic together and help all children get back to being kids. Visit hackensackmeridianhealth.org/COVID-19 to learn more or to schedule a vaccine appointment today.